Hi, everyone, and welcome back to Amplifying Technicians, where amplifying technicians means amplifying communities. My name is Taylor Watterson, and I am so excited to introduce our guest for today's episode, Dr. Emily Hoffins. Dr. Hoffins and I actually go way back. And so I'm super grateful that she has taken time to be a part of our podcast today. In ways of introduction, Dr. Emily Hoffins is actually the inaugural Innovate for Impact Postdoctoral Fellow in Health Systems Design and Safety at the University of Illinois Chicago Retzky College of Pharmacy in the Department of Pharmacy Systems, Outcomes, and Policy, where she actually works with me and does work in the systems-based collaborative research for patient safety or Scripps Lab, and has really been influential in providing her communication and marketing expertise and just her brilliant methodological lens to the work that we're doing to amplify pharmacy technicians as well as improve patient safety. So I'm super excited to introduce her. But by way of background, Emily received her bachelor's of science from the University of Wisconsin-Madison with a major in life science communication and a minor in business management for agricultural and life sciences. And then she went on to pursue her master's and her PhD at the University of Wisconsin-Madison School of Pharmacy. Her PhD is in health services research in pharmacy, and then a double PhD minor in marketing and industrial and systems engineering. And where Dr. Hoffins and I got to know each other actually is that we both worked as research assistants under Dr. Michelle Chewy in the Systems Approach to Medication Safety, or SAMS lab. So I'm super excited. Welcome, Dr. Hoffins. Welcome to our podcast, and super excited that you are here today.
Thank you so much for having me.
Yeah, so I think just to kick things off, right? Shared in your background, aside from your graduate training, you are not a pharmacist, but I'd love to hear about how you got into this pharmacy world, and I'd love for you to tell us a little bit about yourself and your journey.
Yeah, thank you. So, to reiterate, I am not a pharmacy technician. I'm not a pharmacist by training, but I do really appreciate being included in the space that's focused on amplifying technician voices. As you kind of alluded to, my background is really in health communication and patient safety, and my work really focuses on understanding how patients understand and engage with medication information. That might take shape in marketing efforts. That's kind of what my background has been in, but that also really relates to pharmacy settings and how patients are navigating the pharmacy from when they enter to pick up a prescription or an OTC. Who are they engaging with and how are they doing that? That's really where I get excited about pharmacy. I got into this sort of pharmacy system space again through our advisor, and I am so happy to be here. I've just had the best time learning and looking at how communication varies between patients and pharmacy experts.
Yeah, brilliant. I really appreciate your comment around taking the patient voice, patient perspective, and I think that that'll lead for a really interesting conversation today. So I'm excited to hear some of your thoughts too. So I guess to kick things off, I'd love to hear a little bit about your experience doing work with Dr. Chewy in the SAMS lab, but also some of the things that may relate to pharmacy technicians. So I'm thinking about one of the projects that we worked on together before I left that was really around thinking about how older adult patients who frequent community pharmacies, how they can make safer choices around over-the-counter medications. And I know there was a whole intervention designed around improving this decision-making process. We called it Senior Safe, and I'll be sure to link a link to that paper for any of our viewers or listeners that would like to dig in. But I know one of the aspects of that, and one of the parts of that intervention really looked at how patients interact with pharmacy staff members. So I was wondering if you could tell us a little bit more about the project and about maybe your role on the project and kind of how it all ties into pharmacy technicians.
Yeah, definitely. So, Senior Safe, as Taylor alluded to, was a physical redesign of the community pharmacy space, putting safer medications for older adults between shoulder and knee height, I believe, and unsafe medications either lower down or even behind a sign that said, go talk to the pharmacy staff to get this medication. We called that like a red stop sign. And I think those are probably the medications where most of the pharmacy technician role kind of came into play. I'll back up. My role in the study was doing data collection. So we went to 60-ish pharmacies in Wisconsin and sat in the lobby. It was a health system pharmacy and collected older adult patients as they walked by and had them do a simulation where we gave them a case that they could treat with an over-the-counter medication for pain, cough, cold, or sleep, and then sent them in to get a medication and come back. The most that they engaged with a technician, I would say, did come around those unsafe medications, because if they chose a safe medication, the pharmacy staff checked them out and sent them on their way. But when they tried to get a medication that was perhaps unsafe with different comorbidities, or unsafe just in general, that they would have to go behind the counter to access, then the technician was the one who really had to kind of mediate that request by saying, this isn't a safe medication for you. And older adults can be really set in their ways. So this is often a time when older adults would get a little bit frustrated with the technicians and say, like, but I've taken, sorry, this was a few years ago. Taylor, what's an example of a red
Yeah, so like Benadryl or
Benadryl?
diphenhydramine. Yes.
Yeah, they would say, I've been taking this for years. Why can't I get it now? And then the technician was the one who really had to kind of step into that role and say, I'm so sorry, it's unsafe for you now that you're 65 plus. And there's a lot of different communication implications to that when we're thinking about they knew this patient was with a study, but if you're having to guess someone's age based on if they look 65 or older when you're not in a study environment, that can be kind of touchy. If you're trying like in a rush and you have a huge line of people, you want every patient to be making safe over-the-counter medication decisions, but it can be really difficult to kind of know when you put a stop on someone getting a medication, like an over the counter that they're used to, that they perceive as safe. It really does kind of open a can of worms, so to say,
Yes.
where you're getting people out of their normal routine. And that can lead to a lot of questions and frustration. And that's oftentimes
Yeah.
put onto the technician.
Yeah, I'm reflecting to, and from what I remember about the project too, it's a very similar process maybe to patients that are buying any patient, regardless of age, but patients buying Sudafed or pseudoephedrine that have to go behind the counter. It's, a regular process. They have to show their ID. And sometimes, right, like that is based on like an external check. But, that sometimes falls on the technician as well to have to say like, hey, I'm really sorry, but you failed our meth check protocol or you've exceeded purchasing limits. And so there is that kind of awkward conversation there. But then this kind of goes a step farther, I would say, maybe because it's not even like some government entity regulating it. It's this like safety condition that there is being applied. And I think too, when a lot of it goes, right, ultimately it's the decision or having them talk to a pharmacist for that counseling, but it is that technician, you're right, that's on the front lines that has to kind of intercede and interact and have some knowledge of either the study intervention or just in general, these kind of knowing when to triage and when to flag the pharmacist for these kinds of encounters. Is that kind of what you saw or?
Yeah, I think that is primarily what we saw, just given that the technician is usually the one who's at the register checking patients out. When they wanted a medication that was put behind the counter, they did have to go to the technician. And I think, again, a novice perspective of pharmacy, but it's not always even allowed for a technician to be going the step further to making a medication recommendation. Am I right on that?
Yes, correct. Yeah,
So
yeah.
it gets really kind of sticky when the patient is going up to someone who is behind the pharmacy counter. They have this expectation that this person is an expert and is knowledgeable. And even if I can't get this one medication, maybe they can redirect me. But that's often not something that technicians are even really allowed to do or empowered to do. So that can lead to additional tension between the patient and the technician.
Yeah, yeah, that's really fascinating. Do you have, I mean, Is there maybe a way from either from the study or kind of just even going forward, were you able to witness a case of that going really well, or like that triaging experience of how either the technician engaged in a conversation or how they kind of pulled in the pharmacist or had a conversation with the technician? Or do you have even maybe suggestions about how that could happen?
Yeah, no, that's a really good question. There were some times when the technician would be in really close proximity to the pharmacist. So to be honest, the pharmacist would just overhear that the patient wanted this like off limits medication and intercept that conversation. And I think that went really well. Of course, this is also putting more burden on a pharmacist then. There were also some times when the pharmacist and technician just had a really good working relationship, and the pharmacist would say to the study team, like, oh, I really trust uh, this technician, and I know
Right.
that they'll like be able to handle giving a recommendation. I know that's not always what's supposed to happen, but they
Yeah.
had
Well, just
built these
yeah,
different
you can cover your ears,
relationships. Yeah.
audience.
And that worked
Got
really
it.
well.
Yeah. Yeah. I mean, I think too, even again, I'm just reflecting from my own experiences too, but how often that does happen in just any pharmacy setting outside of this study, whether that's an OTC recommendation in general, right? It starts as a patient just asking where something is, and the technician goes and walks out. And then the patient either asks for a recommendation or is like, oh, what do you think? And I mean, I sometimes, when I was still a student, even would trust the technician's recommendation over, like, I mean, obviously the pharmacist, but I would really
Yeah.
trust them. They've been in these positions for such a long time, that I can imagine there's like a bulkiness of like, if the technician helps someone find a product and then the patient asks a question, well, then the technician has to walk the patient back to the pharmacist or go and grab the pharmacist and bring them back out. But I can imagine all of that would be really confusing for the patient too, right?
Yeah, definitely. So this perhaps this is like a communication geek tangent, but patients
Yeah,
really
yeah.
rely on like heuristics when they're entering a pharmacy. So in brief, a heuristic is really like a mental shortcut that we use to make judgments in a situation where we don't have all of the information. So, like at an airport, if you see someone behind a desk, you might assume that they're a flight attendant and they have expertise on that airline or like how flights work. So this also happens in pharmacies, right? We see the technician behind the counter, we assume they are an expert or at least have some sort of training to be in this space that I, the patient, am not permitted to be in. And when you then get to a point with the questions with the technician that the technician can no longer answer, whether it's a barrier of their own knowledge or of like
Legally. Yeah.
legality, yeah, then there really does become this weird tension between the handoff of going from the technician to the pharmacist. While we do want these handoffs and we want patients to ask questions, just getting moved to a different person can lead the patient to think to themselves, like, well, is any of what they've told me true? Is this a reputable place to be? Since I had to get moved between people, it kind of creates a drop in trust, I guess, for
Mhm.
patients, oftentimes, I would say. And that is really unfortunate because we do want people to ask questions. We want them to see technicians as a valuable resource. But
Mhm.
there can be kind of a disconnect between when we're trying to get them the most correct and informed information from the pharmacist, but having to go between the technician and the pharmacist can be a little bit confusing.
Yeah, I appreciate that so much too. And because I mean, all of this is contextual, right? I'm imagine like a lot of these scenarios, I think of it, or maybe sometimes those larger chains, those larger pharmacies that have, 10 maybe people working in the back. And obviously that's very different for maybe a small independently run pharmacy where you have two people working at all times and they've been working there for the past 20 years. But I think too, what's so interesting is that how quickly the tide shifts, particularly around maybe non-clinical questions, because a majority of the time when patients come to the pharmacy, yes, we want them to have clinical questions. Yes, we want them to have, right, these interactions. But in reality, there is a likelihood that they don't have questions, or they've talked to their provider, or, they're coming for a refill. And so primarily, bulk of the questions we get are actually those technical questions in which the technician is actually most well suited to answer, whether that's refills, insurance status, whether or not something is covered under their insurance, when things will be back in stock, like really those management things. And I mean, I've said this here on this podcast, but also I've said this to you and in conversations. I mean, the pharmacy really runs with technicians. The pharmacist is there for legality and yes, to answer questions, but as a pharmacist, I couldn't run a pharmacy without my technicians. And so I think it's interesting too, because I'll get people who would call in the phone and say, I need to talk to a pharmacist. I'm like, oh, hey, what's up? How can I help you? And they're like, oh, I need this refilled. And also, is this covered? And I'm like, I am glad and able to help you, but this may not be the best use of my time. And actually, the person who can do this faster and more efficiently is actually my technician, who, again, is so qualified in so many different ways. But anyways, it's kind of this to your I'm rambling now, but it's to this point about like patient perception of like knowing where skill sets are, who do you talk to, who do you need to talk to in certain instances, and how can we in pharmacy create that like front for patients where we really are all part of a team just with varied expertise and varied different roles, and how can we communicate that in a very busy pharmacy, but also in pharmacies where that's changing all of the time. So that, just my reflection, but really
Yeah.
fascinating work.
No, I really appreciate that. There's 2 points I want to dig further in. The first is that when you're thinking about roles, you're so right. I think that from a patient perspective, honestly, before I even stepped into the pharmacy space, I was in health communication, but had never really been behind the counter, so to speak, in a pharmacy. And I probably wouldn't have known the distinction between a technician and a pharmacist. When I go, I ask a question and they answer me. Like that was my understanding. I knew that they probably had assistants. I just didn't really think about how trained
Mm-hmm.
they were. So from a patient standpoint, I mean, obviously they know if they go into like a chain pharmacy, the person at the cash register is probably not a pharmacist, but the person behind the counter probably is. Uh,
Mm-hmm.
but it's hard to get people to understand, like, even though they're not a pharmacist, these technicians are still really valuable sources of information when we're thinking about pharmacy in general, especially to your
Yeah.
point about questions normally not being clinical. Um,
Mm-hmm.
and this kind of takes me into my second point related to this. A, di- a different study that I did
Yeah,
with
yeah.
Dr. Chewy's Sam's lab was doing these really in-depth 6 hour at a time observations in the community pharmacy. And you're so right. These technicians are amazing. Like I'm amazed as an outsider. They are so fast and so knowledgeable about insurance, refills, all of that, that it really does kind of shift my perspective on, wow, I probably would have been the patient a few years ago that called and said I need to talk to a pharmacist. Why is my
Mhm.
insurance rejecting this, or something like that? Or why did I go from a 90 count to a 30 count on my refill? But
Yeah.
the technician probably can find that information in the chart really easily, really fast,
Mhm.
and
Mhm.
it doesn't need that level of clinical expertise. So gosh, I don't know how to get patients to go from I need to talk to a pharmacist to more I need to talk to someone on the pharmacy team. But
Yes.
I think that maybe this is our next grant, Taylor,
Yeah,
somehow
yeah, yeah.
repositioning patients to approach it more as this is a pharmacy team where everyone has their own like insights. Perhaps not everyone's clinical, perhaps not everyone's logistic, but
Yeah.
there's overlap, and the technicians really are a really valuable resource that do want to talk to
Yeah.
people and can be really helpful.
Yeah. And I know part of this too, and some of this jumps ahead to a future project that I know we'll have time to talk about, but some of that is required, and there are requirements in like legislature around how to like that stores or pharmacies, particularly retail pharmacies, must identify who is a pharmacist versus pharmacy technician. And I know some different chains have different ways of doing that, either with the badges or the color of cloak that they're able to wear or smock. But now that we're moving away from that, like there's so many different variables in that. But I just think it's really fascinating too about, you wouldn't go to, your dentist and ask them for advice about your knee pain. I mean, maybe you would. I don't know your relationship with your dentist, but it's just really fascinating of like, right, like how do we have these expectations for healthcare teams in other settings? And so how do we apply that to pharmacy? But also, I'm really glad that I was not a part of the team when we were doing 6 hour observations. So kudos to you for doing that. But I'd love to hear a little bit more. I mean, were were there any other roles that you saw pharmacy technicians doing or some of those interactions that worked really well or were really great?
Yeah. Uh, a huge thing that stuck out to me was just how well things run when there's a really good relationship between the pharmacist and the technicians.
Yeah.
All of the pharmacies I observed had a really good working relationship, but even if there was like a float pharmacist, you could see things were just a little bit different than the prior observation because people really find these flows with each other. It's just a beautiful team environment, I think pharmacy is. And when it really worked well was when they just had these sort of, I don't know what the word for it, like cues between each other where they would know, okay, if the technician is filling a prescription and the queue of things to get verified by the pharmacist gets really long, the technician would just automatically change to doing insurance verification or doing some of their compounding that needed to get done and making those effortless kind of switches in workflow. I know that's not always necessarily like
Yeah.
able to do that, but it was really interesting to see how they could kind of read each other's workflow and so effortlessly like shift between what's going to work best for the team versus I have this many in my queue and I need to get this done for my own like work
Mhm.
list. Being able to kind of do the decisions that were best for the team. I think technicians were really insightful on that. It's kind of my
Yeah.
main takeaway.
I love that. I love that too. And just really highlighting that like mental flexibility, but also this ability to read social cues, which they so often do with the patients so very well too, but like reading your pharmacist cues and managing, literally almost managing the pharmacy. I think that's why I love that there are pharmacies now that have pharmacy technicians as the pharmacy managers or in whatever capacity they
Yeah.
can be, because like but yeah, that kind of mental gymnastics of having to be everywhere at once, keeping track of all the patients, keeping track of the order, the staff, the inventory, but also like, okay, where's my pharmacist at? What are they doing? How many baskets? What's the queue look like? And how can I best help out and shift around? And I love that being with a technician who right has that is able to do that. I know sometimes like in pharmacy, like as a pharmacist, you try and like do that for your technicians, or especially when you're training new technicians to be able to say like, hey, this is really backed up, can you go do this? But right,
Yeah.
like those senior technicians are those ones that really get it, and are so great to have on teams, have that kind of I don't know, like critical thinking, but also like capacity
Yeah, yeah.
to do that.
Well, and even reflecting on that, and when I had mentioned the float pharmacist, the technicians really do step up and take on that role of unofficial manager of the pharmacy when there's someone there
Yeah.
who might not have all of these inside knowledge on like how does this particular pharmacy work because every pharmacy really is so unique and has their like yes the pharmacies all do like kind of the same thing but the ways they do it are so unique and different
Yeah.
so the technicians being able to say to the float pharmacist like okay here's how we I don't know check the med boxes or this is this particular
Mhm.
area where we have this chaos managed in a certain way like being able to have those cues was like really interesting to see in action. It was just the coolest observation. I know I said it was 6 hours and it was like taxing, but I really did have just the best time observing the teamwork and how everything like is put together so seamlessly for the patient often.
Yeah. Yeah, I love that. But also too, it just totally highlights why you and I work so well together, I think, because we were both very excited about these things. Um, but also too, I think about like the value that there would be of like being able to pull back that curtain for patients. I know I was working with the American Pharmacists Association and they had created this like not pamphlet, but like flow chart for patients of like what is actually happening behind the counter, which is helpful. And like, it's kind of like the tracker, being able to move where things are, but to be able to like actually see like that chaos managed, or sometimes, it's not hidden, but like to see what actually goes on behind the counter, I think would be really insightful for patients and making those
Yeah,
educated calls about what's happening.
I completely agree with you. I've been in the pharmacy space for 5 years now, I think. And even within like my first year in pharmacy, I'm gonna be so honest, I had this impression of like no one behind the counter wants to talk to me. I see them being super busy. Like even when there was that transparency of you walk in and you can see
Mhm.
everyone, they look so busy. They look like they're just really, they look overwhelmed sometimes. And that's like so fair.
Yeah.
Now, having been behind the counter, I can understand, not working behind the counter, observing behind the counter,
Yes.
I can totally see why. Um, but somehow pulling it back for the patient, that curtain to say, like, no, even if people look a little bit overwhelmed, like, they still really want to engage with you. People came into the pharmacy field to, to help people, to be a healthcare provider. I mean, technician or pharmacist, I don't think it matters. I think they all came into this field to be helpful. Like, you chose healthcare to help people with their
Yeah.
healthcare. So
Yeah.
somehow, I don't really know I don't know how that reputation like shifted from because I know like my primary care physician is also very busy. I know that. They come in really fast, they leave really fast. But I still really enjoy my time talking to the medical assistant that comes in beforehand. And that could totally
Hmm.
be applied to pharmacy technician and the pharmacist. So I'm not sure exactly why this difference. It might be because
Hmm.
we can see how busy they are behind the counter. Sorry, now I'm
Yeah.
rambling.
No, it's
But
perfect.
it yeah, there is just like this distinct difference in how we think about pharmacy and what we get from the pharmacist as a
Hmm.
patient. And I think that needs to change, but I don't really know how to do it.
Yeah.
I think it takes understanding that the pharmacy staff are there to help you and that they want to
Oh,
help
yeah.
you. I think that knowledge is what's really important for the
Yeah.
patient.
Yep. Our next grant, right? We just
Yes.
keep adding to the list.
Yeah. Yeah.
So I want to shift a little bit and talk about a related project that now you're working on with me, or we're working on together, in collaboration with the American Pharmacists Association. We're kind of working on this large scale legislative scan of policies, specifically looking at or doing an environmental scan of how does policy vary regarding pharmacy from state to state. And well, I can provide some of the intro and then let you take it from there as doing the methods and that. But right, part of the goal of all of this, from my standpoint, is all thinking about pharmacy dynamics, patient safety, and employee well-being, pharmacist and pharmacy technician, pharmacy staff well-being. And we realized that so much of well-being is built on kind of this balance between the demands that someone is asked to do in their work, but also the resources that they have to do with them, and then kind of things shifting from there. And so when we think about demands and resources, part of that comes down to what roles are the pharmacy asked to do in general, and then how can those roles be delegated? And so part of, I know, our scan, we've been looking at some of the roles and expanded roles for pharmacy technicians and immunizations in some of those different transfers, all of these different things, because we know that that can impact not only their job satisfaction, but freeing up pharmacist time, but also in, right, like job satisfaction, all this jazz. But that being said, me setting the context, I would love if you could tell us a little bit about your work on this project, the massive undertaking, and tell us a little bit more about this work that you've so lovingly done with me and for me.
Yes. It has been another eye-opening shift in research space. There's just so much to pharmacy that I've been enjoying taking in. I had never really worked on the legislative end. So kind of diving into this was super interesting. We had, I think, 26 questions we were looking at, from pharmacist well-being to safety of the pharmacy, and then a couple core questions on technicians and what they're allowed to do, how they're protected with well-being and that sort of thing. We looked at all 50 states and DC, so 51 total entities. And what's really fascinating to me that I also did not know is that every state has such different legislation. They all have their own board of pharmacy with the rules on what's legally allowed, what's not allowed, and that language can be really confusing. And I'm reflecting on how some of the legislation would say, like, oh, a pharmacy technician can do all these things, and they cannot do, but the cannot was kind of small. So then there's another
Yeah.
bulleted list of all this stuff, like they can do or they can't do final verification or handoff of a medication and a
Hmm.
bunch of other things that I'm sure I'm forgetting. But what was really fascinating was this difference in some states having a set guidelines for a certified technician. Is that the right term?
Hmm. Hmm. Yes, yes.
And yeah, and how this certified technician had extra education, not necessarily like full-blown training on medication safety, but more just like additional training on
Hmm.
being like technician roles and things that they do. I'm sure there's a more formal
Yep.
definition. My apologies
We
for
got,
those
nope,
who
you're
are
good.
aware of that. And it was really interesting how by getting this like certification, they were really elevated and able to do things like tech check tech and
Mhm.
perhaps even sometimes doing that like immunizations and that sort of thing. And I think that that's really interesting and
Hmm.
helpful for managing this like very overwhelming workload in the pharmacy, having technicians be able to do that. And it's also fascinating that they don't have that at every state.
Hmm.
I think that it's just so interesting how much it varies on what states are allowing technicians to do. And again, I'm not from a legislative background, so I don't know where these like differences are
Yeah.
coming from necessarily, but it was really interesting to see that some states do um, really empower the staff to decide like who is able to do this. Obviously, we don't
Hmm.
need like the technician who's been there for a week doing tech check tech, but
Right,
someone
right.
who's been there much longer well, makes sense to me. There's a lot of work being done. They have a lot of experience, and
Yeah.
that's something that they could certainly do. So, kind of figuring out how vastly different all of the different states were was fascinating, but also as I got
Yeah.
more into it, I was like, this does make sense.
Right.
Why would they be like, there's so much going on. Of course they should have
Right.
technicians checking other people's work. It just makes good sense.
Yeah.
So that was kind of my
Brilliant.
takeaway.
That's our research. Yeah, yeah, brilliant. And I think too, what's interesting, I'm reflecting on, I mean, yes, I agree too. Yes, this variability, but also too, like how that variability may impact patients too, right? Like, I mean, yes, the practitioner, but like, a patient who's moved from California who allows their technicians to do a lot of things to, I'm just saying this because this is off our top of our head, saying nothing about our listeners in these areas, right? To Alaska, which has much more, does not have legislation around sorts of these things, right? There's a very distinct difference. That patient who is flying frequently between both Alaska and California and filling their prescriptions, what the technicians can do in those states, I mean, and pharmacists can vary. But then how do you shift that mental image of, what a technician can do, what they can't, and how do you carry that forward in these different environments? And I'm sure that varies too
Yeah.
based on the type of pharmacy, whether that's an independent or a chain. Just because the technician can do something doesn't mean that, the chain pharmacy is having all of their technicians immunize or et cetera.
Yeah. Well, or
Yeah.
even in the same state scale, someone who might be in a rural area who has like a remote dispensing, their
Hmm.
technician might be doing a lot more and they're used to that. So then when they move to a state that might not allow remote dispensing or who has more legislative barriers to what a technician can do in a
Yeah.
remote dispensing site, that would be really confusing if you're used to this mental model of going into the pharmacy. It's a technician and they can dispense you the medication, and you have the option to talk to a pharmacist, of course, but
Hmm.
that can be really different going into a place that doesn't have remote dispensing or where the technician is just much more limited in what they're allowed to do.
Yeah. Yeah. Thank you. Um, So also fascinating. I feel like we could talk forever. What we do, as a listener, dear listener, this is what most of our days look like, where we just get to sit and chat about all these cool things. So
Yes.
I want to kind of turn this back a little bit to you and your research interests in general. I know that you have a large focus in your dissertation work and kind of your motivations around kind of improving patient agency and dealing with communication and how people can make decisions around their health. So, from your experience, either doing that research or just kind of going forward, do you imagine that there is a role for pharmacy technicians to help in an assistant health communication or helping patients in making some of those decisions?
I do. I do think that there's definitely a role for technicians in that. I think when we're considering or patients going into the pharmacy, we want people to ask questions. We want them to feel comfortable seeking clarification about their medications. Or a lot of my dissertation work looked at medication advertising. So we want patients to know if they saw an ad for something, they can ask their pharmacist or pharmacy team about it. I think that having technicians be empowered to kind of field some of those discussions, not necessarily needing to go into prescribing or like what would be best for them if it's like a very challenging clinical case. But oftentimes,
Mhm.
pharmacist technicians do have a lot of insights on medication safety, medication classifications. So being able to say, in terms of like OTCs or something like that. So if a patient
Sure,
says,
sure.
I have these symptoms, could you please help me figure out what to take? I mean, I think that that would be a really valuable place for a technician to be able to step in and help them out. One of our
Mhm.
colleagues looked at pharmacy decision making for patients with like sick children and how are patients making those decisions
Hmm.
in the moment when their patient's like the pediatric child is sick and they need to find a safe medication. I think that there's definitely some technicians these who have just a lot of expertise and might be able to leave the behind the counter space to say like, okay, these medications are what we should talk to the pharmacist about, and maybe making that transition smoother to say, let's take these medications, bring them to the pharmacist and have an informed discussion, but somehow being able to be really receptive of the patient's questions and validating that questions are good.
Mhm.
We want to ask questions and that the pharmacy staff is there for you.
Yeah, yeah,
Sorry,
yeah.
that was a lot of
Need a
different
need.
directions.
No, I mean, no, but like being that patient advocate, I'm thinking about like our pharmacy technicians who are super helpful in like navigating insurances, but saying like, okay, call this number, or I'm going to call this number for you. Or, like these are some of the different options that we can take. Right. Like that's one where it's often so, I don't know, complicated, but being that voice there. But I
Yeah.
love this idea of, being a spot to ask questions, even if they're just triaging some of the questions to be like, hey, that's a really, really good question. Let me pull in my pharmacist and let's the three of us have this conversation or whatnot.
Yeah, I
Yeah.
think that still being involved in the discussion can really help make the patient feel validated and like their discussion is is like a trusted source instead of just the handoff where it might
Right.
make you feel like, okay, I interrupted this technician's time. They don't really want to talk to me, but I still, and again, totally validating that there's not always a lot of time and that's just how
Yes.
it is in
Yes.
pharmacy. But by having the handoff with the technician still there, I think would be really valuable. I'm also thinking about how nursing has nurse navigators, and sometimes that's like,
Mhm.
or um, and I was a nursing assistant, but I'm blanking on the acronym that it was. But the main nursing assistant who sat like on the floor when a patient would come or a visitor would come into the hospital floor where we were at, having just like that
Mhm.
nursing assistant there, being receptive to questions, and even if it's just logistics, like how do I find room 10, like being able to
Right.
navigate them there and help people. Healthcare is really vulnerable. So having someone who is just
Yeah.
there for you can be really powerful. And I think the technician is really in a position to be that um, patient advocate and patient
Right.
validator.
Yeah. I My mind is thinking about so many different things. I remember, when I used to work at a chain that now no longer exists, but they had a position for pharmacy technicians that was called a wellness ambassador. And their role was almost literally to roam through the aisles and to be able to answer patient questions, help them find things, bring them back to the pharmacy. But it was interesting that that was almost kind of like a failed experiment, primarily because, I mean, yes, this technician was being paid more, but in times when the pharmacy got really busy, that person was always one of the first to be pulled back into the pharmacy to act to do,
Ah,
behind the bench work. But also, I think one of the things that's fascinating and is a continuing challenge in pharmacy in general, and is the current question about how do things get paid, right? In pharmacy in general, where their profits are tied to a product. Hopefully, that's changing. In a lot of states, that's changing, right? But it's how do you pay for someone's time who is working as this navigator is really important to the patient experience. Is really crucial, but may not have an exact dollar item line linked to profit. So how do
yeah.
you prioritize that role? How do you pay for that kind of person? That's where my brain is also
Yeah.
heading. But it's so important.
Yeah. Well, and it's so hard to put a cost value on the patient experience. I mean, one bad
Yeah.
experience can really derail things for a patient, whether it's them asking another question. They might totally shift pharmacies after just one bad experience. So somehow being able to really make sure that they see your pharmacy as the place where they're no question is a bad question. They know they can get their medication. They know these are really knowledgeable, trained pharmacy staff is so valuable, but you're right, it's so hard to put a dollar amount on
Yeah, yeah. Fascinating. Really cool. Well, I know and again, I have the luxury of being able to chat with Emily whenever I want. So I'm very grateful that, we can continue this conversation offline. But so grateful. Thank you. Thank you. Thank you, Emily, for,
And
for
that
being
goes
here, for being
both
so
ways. I feel grateful for being able to talk with Taylor anytime I want about this fascinating world of pharmacy as well.
brilliant. Thank you. So I'll end this episode like we kind of ask all of our guests. What do you think amplifying technicians and amplifying the technician voice looks like?
Ooh, that's a really good conclusion question. I love that. I think to me, amplifying technicians means elevating their patient-facing roles so they're consistently met with the respect and appreciation that they deserve from patients.
Brilliant. And that's the clip, right? Well, I'll take the soundbite from there. Well, thank you everyone again for joining us for this episode of Amplifying Technicians. We're really always so thrilled to have you and join us next time, where amplifying technicians means amplifying communities. Thanks.